Cool. What's up, guys? How you doing? How you doing? How you doing? I won't be on long today. Just gonna do a quick stream. But you know, gotta showcase. Gotta showcase. Let's go ahead and do. Well, I thought this was gonna be actually smaller than this, but looks like we have to shrink it down quite a bit. All right, guys. This is what we're working with today. We completed the 2025-2026 Generative AI interview guide. So that's good. We've got that. I was very pleased to see another sale yesterday, or I guess 2 days ago, that finally came through. So thank you so much to whoever bought. I think it was Blackjack again. Appreciate you guys. Thank you so much for being for buying up those books. I appreciate it. Here I was once again. This is ironic. Hold up.
All right, buddy, you ready to record? Let's get it.
Nice. Yeah. Wait, hold up. I wonder if these actually say anything. Like, it's pretty cool because he's working on Logic Pro. I use that as well. He's got a couple channels on. He's got some EQ on there too. That's pretty neat. MIDI defaults. He's got the welcome guide on there. That's pretty funny.
What's that? It sounds thin. I feel like a bass should be. It sounds thin to me. It sounds thin. Maybe. Yeah. I think you need to chuck a couple 808s on there. Chuck some 808s. No, I can do that. Let me just.
808s. The zip code. Wait, no, the area code.
Pick it up from the beat drop. I'm outside and it's cold outside. I see a little bird and it opens wide. It's Chloe good. Can you stop? What's that? Do you not want to be here? What do you mean? Do you not want to do this job? I do. What are you talking about? You're not even putting in any I don't even hear any 808s in there. I just think it might sound a little crowded. It needs more 808s. Okay.
Yeah.
He's a German shepherd and I think he's psychic, cause he tells me what I'm thinking and I like it. Yeah, whispers to me when I fall asleep. He tells me what to dream. He tells me there's a bird outside. So I let him outside and he says to the bird, the winning lotto numbers 10, 14, 36, 42, 48, write this out, 41, 46, write this out, 36, 41, 09, 06, 41, write this down, please write this down. Why'd you stop? I feel like the 808 is probably not the problem. Do you not like me? Is it me? Is it the way that I dress? What? And I would put.
All right, this gets a little long, but it's pretty good. Love that. All right, cool. But I did want to do one thing while I'm on channel, and I got a video back from the editor And I thought it turned out pretty good. I don't think that I'm necessarily the most entertaining on these, but I wanted to see what could be done with clips where I'm not really playing into the entertainment value of it. So it was interesting to see him build a narrative on these videos, basically with very little to work off of. So that's pretty cool. Thank you so much. Thank you so much, Prith. I appreciate that. Prith Viraj, I appreciate you. Thank you for that edit. Game does not demand significant decision making from players, making it an attractive option for those who want to enjoy. But I wanted to do something on stream. Instead of don't buy this book, I was gonna change it to burn this book. I thought that would be funny. I'll definitely change the thumbnail. That's just some quick thing that I put on there. But yeah, we'll see about that. We'll see about that. So thank you for the sales. Update to the title. Appreciate you guys. And let's jump right into a project. Can you see it? You can't, because I need to restart the capture. There you go. What's up, guys? Good to see you. Good to see a duplicated channel. What up? Okay. Let's see. What was the last thing that was created on chapter 1? In medical research is expected to lead even more significant advances, transforming medical practice and improving health outcomes globally. Okay, globally. to turn that gain down. That was way too loud. So I'm maxing out over here.
Transforming medical practice and improving health outcomes globally.
Whoa, no. How about this?
As technology continues to evolve, its application in medical research is expected to lead even more significant advances. Transforming medical practice and improving health outcomes globally.
All right. So we were on. There's so many. There's so many of these. If I look up medical law and technological advances. There we go. Let's put this to the side. Ooh. Okay. Had to set up the studio. The main thing that I wanted to accomplish tonight, which I have, is set the space up for future recording. So, definitely did that. Like every time I switch gears from the record to the edit, I gotta break everything down, put it out in my living room, and then build it right back up. Because I'm not gonna do the whole edit in here. It's just too much. It's a different vibe too. It's a different vibe. All right. Let's see what we got. The question is, did I make it to the end of chapter 1? Okay. The last thing that I read on here is transforming medical practice and improving health outcomes globally.
Medical practice and improving health outcomes globally.
Okay. So it definitely sounds like I made it to chapter 2, which is really good. And 45 out of 320, that means about a tenth of the way through. That's pretty nice. I like that.
Privacy in data and other critical information. 1. Readability. More effective responses.
Okay. I'm going for a general vibe of delivery. And I think I got it. Let's go ahead and mute this, duplicate it, bring it up, go into chapter 2, and do a little internal monitoring. Okay. And that's the news. And I think what I'm going to do is I'm going to turn off this audio mixer. Audio monitoring is off. Monitoring output Monitor off. Um. Okay. Sync offset. Interesting. Okay. I'm gonna just turn it off. Well, actually, I'll turn off Evo 8. I know that'll lead to issues if I change the channel, but I'll definitely remember. I never forget. All right, let's see what I can do with this. Chapter 2 is... I want to say chapter 2 is fairly lengthy. Maybe. So chapter 3 is on page 91. So basically what I just did in that recording was, hey, 43 minutes. All right. Okay. All right. See what I can do. I'll see what I can do. When you can't do it all, do what you can. Oh, I literally know what page it's supposed to be on. It's like 40-ish. I was like trying to scroll through and see. All right, there we go. I was trying to look for a page break, and I think it breaks later in the page, so it's just hard to see. Chapter 2, Regulation of Telemedicine and Chapter 2, Regulation of Telemedicine and Artificial Intelligence in Medicine. Concept and evolution of telemedicine. Telemedicine Telemedicine refers to the Okay. Telemedicine refers to the use of information and communication technologies. Telemedicine refers to the use of information and communication technologies to provide healthcare services remotely. Initially, telemedicine involved telephone consultations and basic data transmissions. But with technological advancement, it has evolved to include video conferencing, remote patient monitoring, and the use of mobile apps to manage health, and the use of mobile apps to manage health, and the use of mobile apps to manage health, and the use of mobile apps to manage health. Telemedicine allows patients in remote areas or with limited mobility to receive specialized medical care, improving accessibility and continuity of care. First steps in technological advances. In its early days, telemedicine was basically a tool for telephone consultations between patients and healthcare professionals. Over time, the ability to transmit basic data such as laboratory test results and radiographic images via fax and email began to expand the usefulness of telemedicine. However, the real revolution occurred with the popularization of the internet. The real revolution occurred with the popularization of the internet. The real revolution occurred with the popularization of the internet, and the development of more advanced communication technologies. The introduction of video conferencing enabled more interactive and detailed consultations. The introduction of video conferencing enabled more interactive and detailed consultations, where doctors and patients could see each other and communicate more effectively. This was especially beneficial. This was especially beneficial for specialties that require a visual assessment, such as dermatology and psychiatry. The use of secure video conferencing platforms ensured the privacy and confidentiality. The use of secure video conferencing platforms ensured the privacy and confidentiality of the information exchanged. Remote patient monitoring. Remote patient monitoring is another significant advancement in telemedicine. Technologies such as wearable devices, sensors, and mobile applications allow continuous monitoring of health parameters such as blood pressure, glucose levels, heart rate, and physical activity. The collected data is automatically transmitted to healthcare professionals. The collected data is automatically transmitted to healthcare professionals who can monitor patients' conditions in real time and make rapid interventions when necessary. This type of monitoring is particularly useful. This type of monitoring is particularly useful for patients with chronic diseases. Such as diabetes, hypertension, and hypertension, who require constant monitoring. The ability to detect changes in patients' health. The ability to detect changes in patients' health status early helps prevent complications and unnecessary hospitalizations.
Mobile applications in health management. Using mobile apps to manage health is another area where telemedicine has advanced. Using mobile apps to manage health is another area where telemedicine has advanced rapidly. Health apps allow patients to schedule appointments, receive medication reminders, track their vital signs, and access their electronic medical records. These apps also facilitate direct communication with healthcare professionals, allowing patients to ask questions and receive guidance without the need for in-person consultation. Without the need for in-person consultation. Without the need for in-person consultation. Expansion of the internet and mobile devices. The evolution of telemedicine has been driven The evolution of telemedicine has been driven The evolution of telemedicine has been driven by the expansion of high-speed internet, the proliferation of The evolution of telemedicine has been driven by the expansion The evolution of telemedicine has been driven by the expansion of high-speed internet, the proliferation of mobile devices, and the development of secure communication platforms. The development of secure communication platforms. The availability of fast and reliable internet is essential for holding high-quality video conferences, transmitting large volumes of health data. The proliferation of smartphones and tablets has also played a crucial role in making telemedicine technology accessible to a vast population. With mobile devices, patients can easily connect with their doctors from virtually anywhere, making healthcare easier to access. Impact of the COVID-19 pandemic. The COVID-19 pandemic has further accelerated the adoption of telemedicine. During periods of social isolation, telemedicine has become an essential tool to reduce the risk of disease transmission and maintain medical care. In-person appointments were drastically reduced to minimize exposure to the virus, and telemedicine offered a safe alternative to continue providing health care. Many healthcare systems have quickly implemented telemedicine platforms. And regulations have adapted to facilitate their use. Insurers also have begun covering telemedicine consultations. encouraging both doctors encouraging both doctors encouraging both doctors and patients to adopt this form of care. Encouraging both doctors and patients to adopt this form of care. To adopt this form of care. To adopt this form of care. The pandemic has demonstrated the effectiveness and The pandemic has demonstrated the effectiveness and convenience of telemedicine, and its use is expected to grow. And its use is expected to grow even after the health crisis ends. Even after the health crisis, even after the health care, and its use is expected to continue to grow even after the health crisis ends. Benefits and challenges of telemedicine. Benefits. Benefits. Accessibility. Accessibility. Telemedicine improves access to healthcare, especially for populations in remote areas or with limited mobility. Or with limited mobility. Convenience. Patients can receive medical care from home. Patients can receive medical care from home, saving time and reducing transportation costs. Continuity of care. Facilitates regular monitoring of patients with chronic conditions, improving the management of these diseases. Reducing the risk of infection. Reducing the risk of infection minimizes the need for in-person visits. Reducing exposure to communicable diseases. Challenges. Connectivity. Lack of access to high-speed. Lack of access to high-speed internet in some areas may limit the effectiveness of telemedicine. Privacy and security. Ensuring the confidentiality of digitally transmitted health data is an ongoing concern. Acceptance. Some patients and healthcare professionals may be reluctant to adopt new technologies, preferring traditional in-person consultations. Telemedicine represents a transformative innovation in healthcare, offering solutions to improve accessibility, convenience, and continuity of care. With the continued advancement of technology, and growing acceptance among patients and healthcare professionals, telemedicine is positioned to become an integral and permanent part of global healthcare systems, providing high-quality healthcare anytime, anywhere. Introduction to Artificial Intelligence, AI, in Medicine. Artificial intelligence, AI, in medicine refers to the use of algorithms, software to analyze medical data, support clinical decision-making, and automate administrative tasks. AI can process large volumes of data and identify patterns that may not be visible to the human eye, offering valuable insights for diagnoses, prognoses, and treatments. AI applications in medicine. The application of AI in medicine is broad and diverse, covering several areas crucial to modern healthcare. Some of the main applications include: 1. Interpretation of medical images. Machine learning algorithms are trained to analyze medical images such as X-rays, computed tomography, CT scans, and magnetic resonance imaging, MRI, scans. These algorithms can identify anomalies with accuracy comparable or even better than that of human radiologists. For example, AI can detect tumors, fractures, or other pathologies, often at very early stages, allowing for earlier and more effective interventions. 2. Predicted clinical outcomes. AI is used to predict clinical outcomes based on historical and real-time patient data. Predictive models can estimate the likelihood of post-operative complications, hospital readmissions, or response to specific treatments. This allows healthcare professionals to make informed decisions and personalize treatment plans to optimize patient outcomes. 3. Personalization of treatments. Precision medicine is an area where AI has a significant impact. By analyzing genomic data, biomarkers, and medical histories, AI can help identify which treatments will be most effective for each patient. For example, in oncology, AI can suggest targeted therapies based on molecular characteristics of the tumor, increasing treatment efficacy, and reducing side effects. 4. Virtual assistants. AI-based virtual assistants such as chatbots and mobile apps assist both doctors and patients. For doctors, These quick assistants can provide quick and relevant information, such as treatment guidelines or drug interactions. For patients, they can offer support in managing chronic conditions, answer frequently asked questions, remind them to take medications, and monitor symptoms. 5. Clinical decision support systems. Clinical decision support systems, CDSS, utilize AI to provide evidence-based recommendations to healthcare professionals. These systems analyze patient data and offer suggestions about diagnoses, treatment plans, and health monitoring. Let me try that one more time. These systems analyze patient data and offer suggestions about diagnoses, treatment plans, and health monitoring. By integrating CDSS with electronic medical records, EMRs, clinicians receive alerts and reminders that help improve quality of care and patient safety. 6. Biomedical research. AI accelerates biomedical research by processing large volumes of experimental and clinical data. It can identify new biological pathways, discover disease biomarkers, and predict the effects of new chemical compounds. For example, AI is being used to analyze genomic data from large cohorts of patients to identify genetic variants associated with complex diseases, facilitating the discovery of new therapeutic targets and the development of innovative medicines. Examples of AI in action. 1. Cancer diagnosis. 1. Cancer diagnosis. AI tools, like those developed by Google Health, have demonstrated high accuracy in detecting breast cancer in mammograms. These algorithms can identify tumors with a sensitivity that rivals that of experienced radiologists, improving early detection and patient outcomes. 2. Chronic disease management. Apps like Livongo use AI to help diabetes patients manage their condition. The system monitors glucose levels in real time, offers personalized recommendations, and notifies healthcare professionals if intervention is needed, improving glycemic control and reducing complications. 3. Virtual clinical assistants. IBM Watson for oncology. IBM Watson for oncology is an example of a virtual clinical assistant that analyzes patient data and medical literature to provide personalized treatment recommendations to oncologists. The system can suggest treatment options based on specific tumor characteristics and patient preferences, supporting clinical decision-making. Benefits and challenges. Benefits: precision and efficiency. AI can process and analyze medical data with high precision and at a speed greater than human capacity, increasing the efficiency of diagnoses and treatments. Personalization of care. The ability to personalize treatments based on patient-specific data improves clinical outcomes and reduces adverse effects. Ongoing support. Virtual assistants and monitoring systems enable continuous and proactive support, improving the management of chronic conditions and treatment adherence. Challenges. Challenges. Privacy and data security. The use of large volumes of healthcare data raises concerns about the privacy and security of patient information. Robust data protection measures are essential. Interpretation and reliability. Ensuring that AI algorithms are interpretable and reliable is crucial for clinical adoption. The lack of transparency in some AI models can make it difficult for healthcare professionals to trust them. Integration with workflows. Effective integration of AI into existing clinical workflows is necessary so that healthcare professionals can utilize it efficiently without significant disruptions. Artificial intelligence is transforming medicine by offering new ways to analyze data, support clinical decision-making, and personalize treatments. Its applications range from the interpretation of medical images to the prediction of clinical outcomes and the discovery of new medicines. Despite the challenges, the potential for AI to improve the accuracy, efficiency, and personalization of medical care is vast, and its continued adoption promises significant advances in global health. Regulation of telemedicine and AI in different countries. Regulation of telemedicine and artificial intelligence, AI, in medicine varies widely between different countries, reflecting reflecting cultural, legal, and technological differences. The following is an overview of how some major jurisdictions approach these regulations. USA. In the United States, the regulation of telemedicine and AI involves several agencies and legislation. 1. Health Insurance Portability and Accountability Act and Accountability Act, HIPAA. HIPAA is fundamental legislation that ensures the protection of health data, establishes strict requirements for the privacy and security of health information. Applicable to both telemedicine services and AI technologies that process medical data. HIPAA ensures that patients' health information is protected from unauthorized access and breaches. 2. Food and Drug Administration, FDA. The FDA regulates AI-based medical devices, ensuring their safety and effectiveness before they are introduced into the market. This includes both hardware such as remote monitoring devices and software such as diagnostic algorithms and clinical decision support. The FDA uses a rigorous review process to evaluate the scientific validity, accuracy, and potential risks associated with these technologies. Brazil. Brazil. In Brazil, the regulation of telemedicine and AI is governed by different laws and regulatory bodies. 1. General Data Protection Law, LGPD. The LGPD, inspired by the European Union's GDPR, establishes guidelines for the protection of personal data, including health data. The law imposes obligations on the collection, processing, and storage of data. The law imposes obligations on the collection, processing, and storage of data, ensuring that patient information is treated securely and transparently. 2. Federal Council of Medicine, CFM. The CFM establishes specific guidelines for the practice of telemedicine in Brazil. In 2020, in response to the COVID-19 pandemic, CFM relaxed some of these guidelines to allow for broader use of telemedicine whilst ensuring that the practice is carried out in an ethical and safe manner. CFM regulations define parameters for consultations, diagnoses, and specific treatments. Hold on. And treatments carried out remotely, in addition to guaranteeing the confidentiality of patient information. European Union. European Union. In the European Union, In the European Union, the regulation of telemedicine and AI is comprehensive and harmonized across member states. 1. General Data Protection Regulation, GDPR. One second, I gotta pause. Oh, man. Wow. Maybe they should have done the European Union first, because it seems like they referenced the GDPR when they mentioned the Brazilian people. So it just seems like one should probably come from before the other. That's just me, though. That's just me. I would have put the thing that I'm referencing first before I reference it, but that's just me. What up, YouTube? I see you guys. You're popping in and out. Good to see you. Good to see you. I'm like inches away from quitting for the night, so I appreciate you guys popping in and showing some love. I really do. I mean, we're at 12:17. We started at like 11:40ish, 11:30. So like, it is probably time to take off for the night. But like, I was trying to get a good way through at the very least before we pop off. Should we get through this section at least? I think if we get through this section, it'd give me some peace of mind. Challenges, opportunities. This section really ends on page 67, but we could get through the agencies. Actually, no, on page, 61? 61, I think, is... Yeah, you know, we could do it. We could do it. Let's do it. Let's push. Let's push. In the European Union, the regulation of telemedicine and AI is comprehensive and harmonized across member states. 1. General Data Protection Regulation, GDPR. The GDPR sets strict standards for the protection of personal data, including health data. It ensures that any processing of health data is done with patients' explicit consent and establishes clear guidelines for the transfer and storage for the transfer, storage, and protection of this information. The GDPR also gives patients the right to access, correct, and delete their personal data. 2. European Medicines Agency. European Medicines Agency. EMA. EMA. The EMA, together with other national health authorities, regulates the implementation of AI technologies in medicine. The EMA evaluates the safety and effectiveness of AI-based medical devices, ensuring they meet European standards before being approved for clinical use. The agency works collaboratively. The agency works collaboratively with other regulatory entities to ensure that emerging technologies are safely and efficiently integrated into the healthcare system. Additional considerations. In addition to specific regulations, there are important considerations to be aware of when implementing and regulating telemedicine and AI. Interoperability in technical standards. Interoperability between different healthcare systems is crucial to the success of telemedicine and AI. Regulations often require technologies to be compatible with international standards to ensure the effective and secure exchange of information between different platforms. Cybersecurity. Cybersecurity is a central concern, especially when it comes to sensitive healthcare data. Regulators often require telemedicine and AI systems to implement robust security measures to protect against cyber attacks and data breaches. Ethics and transparency. Ethics and transparency. Ethics in the use of AI is a recurring theme in regulations, with a focus on the transparency of algorithms and the explainability of decisions made by AI. Ethics in the use of AI is a recurring theme in regulations. With a focus on the transparency of algorithms and the explainability of decisions made by AI. Healthcare professionals and patients must understand how AI algorithms reach their conclusions and decisions. Ensuring trust and acceptance of these technologies. Regulating telemedicine and AI in medicine is essential to ensure these technologies are implemented in a safe, effective, an ethical manner. Each jurisdiction takes different approaches, reflecting its cultural, legal, and technological priorities. However, a common element across all regulations is protecting patient data and ensuring the safety and effectiveness of new technologies. As telemedicine and AI continue to evolve, it is expected that regulations will also adapt to keep pace with these technologies, with these advances. Fostering an environment of continuous innovation and self-care. All right, I guess that works. How long was this before? Oh, it was an hour and 43. Okay. It wasn't 43 minutes. It was an hour and 43 minutes. Okay. Let's go ahead and save this. Well, that just means that we're almost halfway there. We made a chunk into chapter 2. That's all I care about. We're on page 61 at the very bottom. Challenges and opportunities in implementing telemedicine and AI globally. So that's where we are, guys. That's where we are. I'll close my MacBook Pro. Sorry, what is this? It's I don't know, a tablet? Who cares? Who cares? It's a name. I knew I would forget that. I knew I would forget that. I forget that every time. But luckily, I have this handy dandy little icon down here that tells me when I am not receiving sound. So I just want to say thank you guys for tuning in, popping in and out as I'm recording this very late at night. I know it's very, very late. So thank you guys for tuning in. I appreciate you on Twitch. Thank you very much, Twitch. I appreciate the view. And, if you're watching this on the playback, I love you. Thank you. And if not, and you're watching this on the compiled version where I put this all together in one big project, I love you. And join me on the live stream, okay? And you can see this whole thing raw and unedited. It's raw. Anyway, love you guys. Thanks for tuning in. It's pretty late, so I got to go to bed. But I love you. Thank you. See ya.